Hey there, it's Dr. Sarah. Welcome to the She Found Motherhood podcast. Today I'm talking with Dr. Bree Budlowski. Dr. Bree is a specialist emergency medicine physician who also practices aesthetic medicine in Victoria, British Columbia. Today, Dr. Bree and I are chatting all things pregnancy and skincare, and Dr. Bree is answering the top questions she most commonly gets around skincare and pregnancy. Now, if you're listening to this podcast, chances are you're pregnant or planning on becoming pregnant. When the time comes to start thinking about labor and delivery, we'd love to invite you to check out our online Pregnancy to Parenthood masterclass in labor and delivery. Dr. Alicia and I curated this course specifically to take you from anxious and overwhelmed to confident during your childbirth experience. It's a complete online prenatal course that covers not only what to expect in the weeks leading up to delivery and the birth experience itself, but a huge amount of information around preparing for the fourth trimester and taking care of your newborn. If you're interested in learning more, please head over to our website, www.shefoundhealth.ca/masterclass to learn more, and we'll be sure to put the link in our show notes as well. We'll get right into the podcast after this short message.
Welcome to the She Found Motherhood podcast. We are Sarah and Alicia, two doctor moms who are creating a community rich with high-quality information to support people through the journey from pregnancy to parenthood.
Our goal is to empower with knowledge and decrease the anxieties during this time in our lives. We cover topics from fertility through the fourth trimester, with the odd birth story sprinkled in.
Come join us on Instagram or Facebook at she.found.motherhood, or check us out on our website at www.shefoundhealth.ca.
Some of these podcasts have been sponsored, which allows us to continue putting out free, amazing content. But don't worry, this won't affect our advice or recommendations, and we only partner with companies we know and trust, or have come highly recommended to us by you, our listeners.
She Found Health is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information you hear does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The views expressed by She Found Motherhood and our guests are not representative of any institution with which we are affiliated.
Welcome, Bree, and thank you so much for joining us on the She Found Motherhood podcast. So as you guys know, I'm talking to Dr. Bree Budlowski, who does not only emergency medicine, but she does, what's the exact title that we call your cosmetic and skincare?
Yeah, or aesthetic medicine. I call it cosmetic and skincare, or aesthetic, interchangeable.
Perfect. Okay. So we're talking to Dr. Bree, who also has a lovely Instagram profile that we'll share in our show notes. And Bree and I were chatting a little bit beforehand leading up to the podcast, and we thought a really great way to introduce this conversation is to start by talking about how all sort of cosmetic and skincare products are regulated, so that you can understand when you're making choices about what to use during pregnancy and breastfeeding, that you understand what sort of process that the government has gone into approving or not approving any of these products that we're using. Does that sound like a good place to start?
Yes. So one of the most common questions that I get on my social media, and I would say this probably is representative of my following, which is primarily young women and women of sort of childbearing age, is what is safe and what is not, and not just with the injectables, which are classified as medications, and so they're strictly regulated, but day-to-day skincare, sunscreens, creams, lotions, topical treatments, that kind of thing. And I agree. So I think understanding how it's regulated is important, because it also will give you a bit of background as to where your practitioner is coming from if their recommendations vary, because they're interpreting the guidelines themselves, and also allows you to sort of be armed with the information to make the decisions on your own. So we're in Canada, and in Canada, cosmetics are regulated under the Food and Drugs Act, and they have their own category. And while Canada's system of testing and regulation is much more advanced than in the US, I feel that there's still some room for improvement. Nonetheless, Health Canada has actually banned or restricted the use of over 500 chemicals for their use in cosmetic products. And if you want to know what these items are, you should not be finding them within your skincare that you're purchasing in Canada. But if you have something from overseas and you want to check, Google Canada's cosmetic ingredient hot list, and it's a government list. It's a government website.
Heard of this? I'll put that in our
Yes.
show notes so people can easily access it.
Yeah, it's good to be able, I mean, there's a lot of jargon, right? So there's going to be a lot of weird names of things, and but if you do want to check, then that's a good starting point. So the way that Canada regulates cosmetics is with a process called a risk-based assessment approach. And so what this means is that if they know that a chemical has risks associated with it, they have it so that the chemical can still be used in products if the risk of exposure is considered low enough. So if the vehicle that it's in means that you won't absorb it, or the percentage that it's in means that the blood levels are low enough that it's not being proven to be dangerous, as opposed to banning it outright. And the other side of this is that cosmetic products also don't require pre-market approval and testing. It's sort of up to the manufacturer to have their items tested and to ensure that they meet guidelines. And they certainly will be reactive, and if there are reports of adverse effects from a product, or if somebody does private testing and they report to Health Canada that there's an issue, then they will go after it. But that's actually not part of the criteria before it's released on the market. So over 500 chemicals have been banned from cosmetics in Canada. There's only 8 in the States that have been banned, which is interesting.
Wow.
But in the EU, they use something called a hazard-based assessment model, which means that if there's a hazard at all, or if there's a risk at all, then you're not allowed to use it whatsoever. And so over 2,000 chemicals have been banned there.
Oh, interesting. That's
yeah.
So
now,
variable.
so it's so variable. There's still obviously a lot of questions to be answered about product safety. They're valid questions. As you can imagine, there's still a lot of unknowns. And the truth is that most topical treatments, or treatments that you put on your skin and not kind of in your mouth, are only minimally absorbed anyway. And so even if they did have something on the naughty list, then usually they're actually not too bad. With the exception of a couple of things. So you kind of have to know that information, know where to look to cross-check if you're really worried, and evaluate your own risk tolerance here.
Mm-hmm. So you would recommend for people, say, like, we get this question all the time as maternity physicians about certain products, and I don't know, right? There's so many products out there, so they could look at the ingredients and then cross-check it on that hot list.
They can cross-check it on the hot list. Yeah. And in general, I recommend products that have a minimal number of ingredients, that don't have a huge list. And in general, ones that are from well-known companies that are regulated within Canada. Yes.
Now, there are a few topical products we know should not be used in pregnancy, right? And one of those is retinoic acid. Is that
yeah. So the vitamin A products, we know that Accutane, or oral vitamin A derivatives, are dangerous in pregnancy. They're a teratogen, which means that they can cause fetal anomalies. And it's sort of by extension that we say that vitamin A products used topically are therefore also dangerous, when it is actually a little bit controversial. So still we avoid, or we recommend avoiding any vitamin A products while you're pregnant. In breastfeeding, you should be talking to your physician about the risks and benefits of that product. And then the other one that you can buy without a prescription is hydroquinone. And typically it's prescribed in percentages greater than 4%, but you can actually buy it without a prescription in lower concentrations, and it's used for hyperpigmentation. And that's one of the few drugs that is absorbed at a fairly high rate. And so I recommend avoiding that in both breastfeeding and in pregnancy as well.
Well, that's good to know. So, I always wonder about, sometimes people ask me, I didn't know this was bad. Like for vitamin A, for example. So I think that's really reassuring that it's by extension. So, I mean, I would probably counsel people to not use it because we don't really have some of the evidence there, but that we can reassure them that there's no clear evidence of harm. We just know it's from the oral medication, right? Not the.
Exactly.
Yeah.
Yeah.
Oh,
So if you didn't know that you were pregnant and you've still got a
yes.
tube of your retinoid in your drawer, don't freak out. Let your doctor know. And if you are on Accutane, then do be really diligent about your birth control.
Yeah. Yeah. Oh, yeah. We're very strict about that.
Yeah.
So, with that in mind, I wondered if you wanted to comment on just sort of like a general healthy skincare routine for people who are pregnant, in terms of how to take care of their skin, because sometimes people have a lot of significant skin changes in pregnancy. Other people don't, but just sort of a general good recommendation before we get into a few specific conditions that I know people often are asking us about.
For sure. And there's no one size fits all formula, but keeping it really simple works for most people. So an easy pH balanced cleanser, which is one that's sort of close to your skin pH, which is slightly acidic, means that you don't need a toner. So that's a good thing to have on hand. In general, I recommend products that are fragrance free or perfume free, as that's just another source of irritation and it's not really necessary in your skincare. So a moisturizer that's scent free, and then every day, winter, spring, summer, fall, SPF. If you're concerned about absorption of chemicals, then you could use a mineral-based sunscreen. There isn't evidence of harm from the chemical-based sunscreen, so I don't think that it's something to worry about. But if you are a little more risk averse, then go to a mineral-based one where there's no absorption at all. And beyond that, you don't really need much else. I mean, you could throw in a vitamin C serum if you wanted to target hyperpigmentation or skin tone during pregnancy. That's perfectly safe. Most other topicals can be added in after your delivery, but really keeping it simple, keeping your skin hydrated and wearing your sunscreen every single day is what's most important.
That's great advice, and advice I need to follow. I'm guilty about the sunscreen piece. Well, and something I find interesting with that is that if a moisturizer contains a sunscreen, it's not going to last all day, right? Like, should you reapply?
You should be reapplying your sunscreen every 2 to 3 hours.
Yeah.
And more frequently if you've gone in the water or if you've sweat a whole bunch, you've exercised. Most of us aren't doing that, especially if you're wearing makeup. You can buy powdered mineral sunscreen.
Oh, yes.
There's one at Costco that's an SPF 15. Color Science makes one. I'm not married to a specific brand, but there's a bunch that you can buy, and having that in your bag is nice because it goes over top of makeup nicely if you need to reapply in the day. And it's also easy to hit your kids with it too.
Yeah,
you don't feel like getting greasy on the go.
Yeah. You know what one I've used is Eminence Organics.
Yes.
Oh, it's beautiful. I don't think it's cheap, but it's so like, oh, you feel like
well, it doesn't have to be what you put on in the morning. Honestly, the best sunscreen is the one you're going to wear.
Yeah.
So, you want one that's broad spectrum and at least an SPF of 30, if not 50 every day. But if you choose it because it looks pretty sitting out on your counter and that's how you remember to put it on, great. If you choose one that acts also as a moisturizer or is tinted and you skip a step in the morning putting it on, the best sunscreen is the one you're going to wear.
Yeah. No,
yeah.
Yeah, I should follow that advice. I will. Moving forward, okay?
Good. Perfect.
Here's New Year's resolution.
I feel like that's the number one piece of skincare advice that anybody should take home. SPF every day.
Yeah, totally.
Yeah.
So, moving on from basic skincare routine, a question that we sometimes get is for people who are wondering about, so people who have gone for like Botox or fillers in the past and now they're pregnant, and what should they do in pregnancy in terms of these treatments?
Yes, and I get that question a lot also as a provider of these treatments. And while it's not illegal or banned to get these medications during pregnancy, you're not going to find a doctor who's going to knowingly give you Botox or filler in pregnancy, at least in Canada. And that's because they're not studied during pregnancy. We know that these medications, these treatments only really act where they're placed, and that the systemic absorption is very low. And so it's likely safe, but no pharmaceutical company is going to throw their money into studying Botox in pregnant patients. It's just simply not worth the risk if something did go wrong. It's a liability to them. So there's very little data out there on this. I don't treat women in pregnancy, and hopefully you can't find somebody in Canada who will treat people during pregnancy, just because I think it's worth the wait till afterwards.
Yeah.
I did find a study that looked at physicians who offer Botox and fillers, and they looked for physicians who admitted to knowingly treating pregnant women, which was kind of the closest I could find for a safety profile. And this, in my opinion, already introduces a bit of bias, because I find in general, physicians probably wouldn't want to admit to doing this in pregnancy. So clearly it states that those physicians felt that it was safe if they were knowingly doing it and admitting it to it. And so maybe they're less likely to report an adverse event if it did occur. Nonetheless, they looked at 900 physicians in this study, and only 12 admitted to performing injectables on pregnant women. There was no correlation between Botox and poor fetal outcomes, but it's not a causation study. It's just it's a reporting study. So not all that helpful. It's probably safe to do this, but don't.
Yeah. Well, and what I find reassuring from that part of the conversation is that, so again, lots of people get pregnant unintentionally, like I went and did.
Yes.
Right?
Yeah.
And so, I think it reassures us that, like, we don't have to be perfect all the time. Like, so say you're pregnant and you don't know it and you got Botox. Like, yes, we will recommend that you don't continue to get it any further throughout your pregnancy, but there's unlikely to be any significant harm from that.
Exactly. We use in cosmetic Botox, we're using such tiny doses. It's a purified protein that gets taken up into the neuromuscular junction quite quickly. There is not evidence of systemic absorption at these doses. And so it's almost certainly safe even in pregnancy, but we don't have the data to support that. And as an elective treatment, it's one that's probably worth avoiding.
Yeah.
Now, in breastfeeding, I think you're going to find more variation in practice. It hasn't been studied, but Botox injections are generally recognized as safe. And Botox toxin has not been reported to transfer from mother to child in breast milk. There are case reports of women in the ICU, the disease from the bacteria that creates this toxin in nature. So high levels to the point where they are paralyzed, and they continue to have somebody help them pump and give express breast milk to their babies. No evidence of any side effects to baby in those situations where the level of toxin systemically would be so much higher than anything that you would ever see in this type of treatment.
That is fascinating.
Yeah, it's really interesting. So these are case reports. There's no huge database on this, but we know that Botox remains where it's injected. It's very unlikely to get into your bloodstream, never mind your breast milk. And then the fillers that we use are generally hyaluronic acid based, and they also contain some local anesthetic, and they stay where they're put to. And so in general, those would be considered safe as well. But talk to your provider, find out what their comfort level is, think about, the benefit to you versus the potential or unknown risks, and make an informed decision that way.
Yeah, that's really great advice. And, something I think that we had briefly touched on, and maybe we can talk about now is, I think that from, both you and I in the work that we're doing, sharing information on social media, our goal is to empower people, to help them make their own choices. And so something that I think can help empower people when they're choosing whether or not to do certain treatments or medication is to understand the way we sort of categorize medications when we're talking about pregnancy.
Yeah, absolutely. I think that, I mean, knowledge is power is something that we say over and over again. And your healthcare providers our role is not simply to make decisions on your behalf. I feel like our role is as an educator for you in your own body and whatever condition you have. And so giving you as much information as you want is part of our job. And we practice joint decision making, which means that, I mean, we have the training and experience to give our suggestions, but we're not living in your body or with your conditions or with your experiences that might influence the pros and cons of a treatment. And so kind of knowing as much as you can about what's going on and the treatments that you're seeking is important.
Oh yeah. Oh, totally. So, maybe just quickly, I'll touch on what those pregnancy categories are. And it's easy, like if you're being prescribed a medication or considering a treatment and you want to know what category it lies in, you can just literally Google FDA pregnancy categories. And typically in pregnancy, we're comfortable using anything that falls within the category of A or B. So A would be that we've actually had adequate and well-controlled studies in pregnant people that have failed to demonstrate a risk to the fetus, and that there's no harm shown during any trimester in pregnancy. Unfortunately, we don't have a ton of medications that fall in this category because, as I'm sure most people have learned during the COVID pandemic, when we're talking about the COVID-19 vaccine, that we just don't study pregnant people, which I think is really a detriment to such a huge population. But again, this would be considered the most safe category. I would say the one that probably we most commonly end up prescribing or suggesting medications would be category B. And that's where we see animal studies that have failed to demonstrate a risk to the fetus, but there are no well-controlled studies. And then, category C is a little bit trickier. So that's where animal studies have shown an adverse effect on the fetus, but we don't have any human studies. But we might consider using it anyways because potential benefits may actually warrant the use despite risks. So just understanding how we look at medications and suggest their use in pregnancy, it's important to understand that they are rated, and we do take that into consideration when talking about medications in pregnancy. And if you want to learn more about the different categories, just we can put a link to that in our show notes and you can check that out.
Awesome. B for baby. Did
you
learn that?
Oh my gosh.
I feel like I learned that in med school, and that's one of my supervisors was like, yep, B for baby. It's probably fine.
Yeah, oh, totally. And honestly, right, that's probably where most of our medications fall because we just don't have that many studies in pregnant people. But that's something, again, that people can use to look to when they're trying to make a decision. So I think now we're going to chat about, so for those of you who follow both Dr. Bree and us on social media, know that we do regular Q&As, and there are a few skincare topics we get common questions about. And so we thought we'd cover some of those conditions in a little bit more detail today. So the first one that I think we get asked about almost weekly is perioral dermatitis. And this is not an uncommon condition in pregnancy. Some of you might not know what it is, so maybe you can describe it a little bit, Bree, and then share with us what you think the best way. And I'm going to be learning and taking notes so then I can do this for my patients when I'm treating.
In general, where I'm treating skin conditions, such as the ones that we'll go through, is mostly in the emergency department, or at least identifying them. I practice primarily cosmetic and aesthetic medicine as opposed to clinical dermatology. I'm an emergency doctor. And so that said, I'm pretty good at making the diagnosis for most of these things, but I do often refer you back to your primary care physician as well. And so we'll be a team in learning about these issues. So peri-oral dermatitis. So breaking down, so many medical conditions have funny names, but they usually mean something. Peri-oral means around the mouth, and dermatitis, itis, when you see that at the end of a word, means inflammation. Derma is your skin. So inflammation of the skin around your mouth. And some people do advocate to change the name to peri or official dermatitis, because you can also see it happen around the eyes and the nose. And the name sounds a little bit like eczema when you hear dermatitis and inflammation, but usually it actually presents as little pustules or zits, essentially, and usually it burns and stings, and we don't really know why it happens. Things like irritants and topical treatment can lead to it. Your mask, now that we're all wearing masks all the time, can lead to it, but then often there are intrinsic or internal factors such as fluctuations in your hormones, as we see in pregnancy and breastfeeding, that can lead to this. And it certainly happens more in people who have eczema, but why the disease happens is still not totally clear. There's also, interestingly, a link to people who use high potency topical steroids. They're more likely to get this. So
Interesting.
that's perioral dermatitis. So if you end up getting a whole bunch of little pimples around your mouth or your nose, that might be what you're battling, and you should talk to your primary care physician about it.
Yeah, and I find for some reason it can be tricky to diagnose. It can often get mistreated and mismanaged, and I think it's because it can appear like if people have acne somewhere else, or sometimes. So knowing about this condition, I think, can help people look for help and treatment.
Yeah, absolutely. Ask the question, could it be?
Yeah, exactly.
Yeah, so with this condition, the first line of treatment is safe in pregnancy and breastfeeding because it is doing nothing. So it's called zero therapy, which is sort of a fancy name for literally doing nothing. So eliminate all topical treatments, particularly steroids, but avoid cosmetics and ointments. Give your skin a break, allow it to heal. Make sure you're washing your mask frequently and using a soft fabric where you can, like a cotton mask, if you're not working in healthcare and married to a medical or surgical mask. And if that doesn't work, then most of the treatments for this condition are actually not safe in pregnancy and breastfeeding. We use medications in the calcineurin inhibitor family. So Protopic is one that you might have heard of. And Elidel is another, and those need to be skipped. So normally those would be first line treatments for this condition, but we have to move down to a safer category in this patient population, which is usually topical antibiotics. Erythromycin and clindamycin are ones that come in a topical formulation. We use them also in acne, and those are considered quite safe, or a category B.
Yeah, that's really helpful. And I'm sad. I thought maybe you had come up with some other in your deep research, something else that's safe in pregnancy. Yeah, because I think that's one of the hard things, is that when we're pregnant, we can't put ourselves first, right? And so this can be really depressing for people. And
there's already so many changes too, I feel, during pregnancy that there's obviously a subset of women who just are so confident and glowy and like amazing. But I'd say, at least in my pregnancies, like I lost confidence. And your face changes, your body changes. You don't know what's going to happen next. You hurt. And then if you get a whole bunch of pustules around your mouth, it sucks.
Yeah, it totally does. And so yeah. I think what I would want the message to be is, like, seek help if you're having these symptoms, and ask the questions like, could it be this? And don't be afraid to use the treatments. I know so many pregnant people are just afraid to use anything in pregnancy because they don't want to impact the pregnancy. But your mental health and how you feel about yourself in your pregnancy is important. And I think can impact that relationship that you have with your growing baby and your fetus. So if you're really feeling self-conscious and you're uncomfortable and you're distressed, ask for help and get the treatment.
And your partner too, right? I think that we see so many relationship changes during pregnancy too. And if you're not confident, or, you know, it might impact your, I don't know.
Your
I think
partnership.
it's
Absolutely.
exactly as you've said. Yeah. Yeah, for sure.
Time. Yeah.
Yeah, absolutely. And then I guess there's a cotton mask for when you're out and about these days.
I know. I'm over it, as I'm sure you are. We're clearly recording this podcast in
Man, I'm so excited for my vaccine.
Yeah, when
like
are you getting it?
Oh, I don't know yet. I feel like, though, if they told me that I had to get it in my eyeball, I would. I'd be like, like I want it. I'm so excited for my vaccine. I'm really happy with that data.
Yes.
Man, it couldn't come soon enough.
Oh my gosh, I know. I can't believe it. My husband's gotten his already, actually.
Oh, really? That's so great. He must work a lot
on Christmas Eve. He does.
On Christmas Eve?
Yeah.
Well, that's nice.
So the next common condition that we get asked about, and I think it's similar to perioral dermatitis in terms of like the importance of treating it if you find it distressing, is talking about acne in pregnancy and breastfeeding.
Yeah, acne is not unique to pregnancy, but in pregnancy you have a whole bunch of changes that mean that your skin changes, and sometimes that's for the better. So that pregnancy glow that people talk about, which is both from your blood volume increasing, so you get a little more flushed and glowy, but you also have an increase in the production of hormones called androgens, which means that your skin produces more sebum, which is sort of like an oily, waxy substance. And so this could be hydrating and make you look kind of dewy, but it can also clog pores, and that can subsequently, you can have bacteria invade and thrive in that environment, and then inflammation and breakouts. In my first pregnancy, I had a really bad acne, and I didn't so much in my second. And my physician appropriately prescribed a topical antibiotic for me. And then as it turns out, I was allergic to it.
Oh no.
And so I got like my forehead where I was applying it was like this red raised plaque. And then I also had acne. And anyway, I feel your pain if this is an issue. And yeah, some women are lucky to have the hormonal changes be protective, and some women unfortunately have more breakouts.
So let's talk a little bit about treatments for acne and what we would recommend doing and recommend avoiding in pregnancy and breastfeeding.
For sure. And again, this is something that you should talk to your care provider about. Basic skincare. So limit the other irritants, wash with a gentle cleanser, don't touch your face, don't pick, as well as you can get sort of introduction of more bacteria and inflammation there. Those are good ideas for everybody. And one category that we didn't mention when talking about the categories of drugs was category X, which are medications where there actually is proven harm. And Accutane, which is a common oral treatment for severe acne, is a category X. So not safe in women who are pregnant or trying to conceive. And usually when you start on this medication, you are also started on a reliable form of birth control, even if you are not currently sexually active, just in case there's a change.
Oh yeah. So yeah, category X, demonstrated fetal harm, right? So we absolutely avoid those in pregnancy.
Yes, and vitamin A topical treatments, so your retinols, your retinoids, your retinaldehydes are related to Accutane. We know that they probably are not absorbed systemically, but based on the proven harm from oral treatment, we recommend not using these topicals during pregnancy either. They're okay during breastfeeding. Reasonable options to treat while you're pregnant and also when you're breastfeeding are similar to treatment for perioral dermatitis. So your topical antibiotics, your erythromycin and clindamycin. But another topical that you can use during pregnancy as well is azelaic acid. And having that prescribed, so between 15 and 20% is effective for acne. Interestingly, it also has a lot of the same benefits to a lesser effect as topical vitamin A treatments. So helps with fine lines, discoloration, and sort of evening your skin tone as well. So if you are normally on a topical retinoid and then you want to get pregnant and you still want to have a little help with your glow, then you could switch to azelaic acid.
Yeah, and that's one I actually not uncommonly prescribe. I like it because it's not quite as harsh as the Accutane, which can really be drying to your skin.
Absolutely.
Yeah.
It makes you so much more sun sensitive too.
Yeah. And do you want to touch on benzoyl peroxide and salicylic acid? I know those are other common acne medications that we sometimes use.
Yeah, they're considered pregnancy class C. And so some doctors will use them and some won't. Again, they're topical treatments. If you are pregnant, usually not using these treatments. I'm a little more on the conservative side personally when it comes to pregnancy. During breastfeeding, I think it would be fine. Have a discussion with your doc.
Absolutely. Yeah. And I think that's the most important thing, is to be informed and then have a conversation, and then you yourself choose what you think is the best for you. Right. And everyone's going to have a different opinion about what is right for themselves, but having the information and knowing the risks, I think, is the best power we can give you.
For sure.
And then the last one, which I find so fascinating, and I think a lot of people who haven't been pregnant before don't necessarily know about, and that is a skin condition called melasma.
Yes. And if you have not been pregnant before and you haven't heard about this, and consider yourself lucky, because you can do a lot to prevent it if you know about it, essentially. And again, this goes back to the SPF thing that I hammer in. We'll talk about that in a sec. So if you haven't heard of melasma, then lucky you. It is hyperpigmentation, so sort of darker patches. So not like moles, but actually whole areas, usually in areas of your face where there are more melanocytes or pigment cells. Melasma, you'll tend to see sort of around the hairline. The upper lip is also affected commonly, which is really frustrating to women because sometimes it can look a little bit like a mustache. And many women are sort of distressed by that. It affects women with darker skin more frequently because they have more of the pigment cells or melanocytes. And estrogen exposure, so whether that's from pregnancy or the pill or HRT, increases the chance that you're going to develop melasma. And once you've got it, unfortunately, it's something that you are likely to battle long-term. So the mainstay of treatment for melasma, so this is why you're lucky if you haven't heard of it and you haven't been pregnant yet, is prevention. And the best thing that you can do is photoprotection. So wearing your SPF every day, wearing a hat, if it's not COVID and you're going to travel somewhere particularly sunny for a baby moon, be really diligent not to try and get too much sun for a variety of reasons, for your skin health in general, but also for melasma. And as you mentioned before, also don't forget to reapply your sunscreen during the day. That is the best thing that you can do as far as prevention. Once you've got it, it's a bit harder to erase.
Yeah, I know. I see a lot of people who have this, who get this in pregnancy, and then treating it can be really challenging. So do you want to touch a little bit on that and how you might recommend treatment?
Yeah, so it's hard. And I mean, a lot of the treatments you're going to have to wait because they're not safe in pregnancy. In pregnancy and breastfeeding, again, azelaic acid has been shown to be of some benefit. But the most effective treatments that you can use topically, I'd wait until you're done with your pregnancy. The safety is also uncertain in breastfeeding, and that's hydroquinone, which is a medication that prevents further production of melanin or the pigment. And that should be used with the supervision of a physician. because you don't want to use it year round. There's sort of an on-off regimen that you'd want to use, and also have a follow-up with your doctor a couple of weeks in to look for effectiveness. Hydroquinone plus a topical retinoid is likely to be helpful. There are a number of sort of peels and lasers for hyperpigmentation that can also be beneficial. And there's some evidence for oral tranexamic acid as well,
weird.
which is interesting. A number of companies are putting tranexamic acid into their topical treatments as well to try and target hyperpigmentation. The evidence is better for oral tranexamic acid than for topical, but that could be helpful if it was really severe and distressing.
That is interesting.
Mm-hmm.
And what about azelaic acid? Is there any benefit in using that for melasma?
Yes, there's some benefit, and you could certainly do that during pregnancy and breastfeeding. It's not as good as the above.
Yeah.
But it may be helpful.
That's great. So I think to summarize our wonderful conversation today, so we talked a little bit about just like the background and understanding cosmetic and skincare product safety in Canada, and how you can empower yourself if you've got some products at home and you're not sure about. You can check out that hot list. And we talked a little bit about the pregnancy categories. So again, we'll put a link to that in the show notes below if you have any medications that you're curious about and wanting to learn a bit more. And then we talked about the 3 most common conditions we get questions about: perioral dermatitis, acne, and melasma, and gave some ideas about understanding the diagnosis and how you can empower yourself to get some treatment if those skin conditions are really bothering you in pregnancy.
I mean, it was pretty content heavy episode.
Oh yeah.
But lots to read about and ask the questions. I mean, learn a little bit about it, ask if this is what it could be. When you're on this journey, then your physicians are here for you to try to navigate what is the best formula for you. And it's okay to still be interested in your skincare and your appearance and that kind of thing when you're pregnant and when you're breastfeeding, and this is normal, it's healthy. Take care of yourself too. You have your own personal needs and interests. And so researching and actually using the medications that are appropriate for the condition that you have is important.
Absolutely. Yeah. Thanks so much for your time, Bree.
Thanks for having me.
Oh, total pleasure. And guys, I will link to Bree's Instagram in the show notes, as well as to those few different things we talked about in the podcast. Have a great day.
Have a good day.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood, and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.